Dissociation is something that people can experience during periods of grief and mourning. And unfortunately, trauma can actually change the form and the function of the brain. Hi, this is Jim Breon. Welcome to this YouTube channel where we discuss all things mental health. I'm a licensed marriage and family therapist and also a licensed professional clinical counselor in Orange County, California. What I'm going to be talking about today is part of the series we've been doing on trauma. And specifically, I'm going to be talking about trauma and dissociation. First of all, let's start off by defining what trauma is. Trauma is understood as an emotionally overwhelming response to an event or a series of events that overwhelms the person's ability to cope with it psychologically and emotionally in the moment. What is traumatic for one person may not be traumatic for another person because of lots of different individual differences as far as resilience, temperament, personality types, lots of different factors. And there are such things as shock trauma, which is, I think, what most people tend to think about. The trauma that somebody might experience in a war situation or being attacked physically, sexually, that's shock trauma. There's also such a thing as developmental trauma and complex trauma, which are a series of events that can be traumatizing for people. They're not necessarily one single event, but maybe repeated events, instances of being bullied repeatedly, having racial slurs or homophobic slurs hurled at you, repeated instances of being shamed, of being disrespected, of being manipulated or emotionally abused in a relationship. And that form of trauma, complex trauma, can be just as damaging as shock trauma to people. Now, let's talk about what dissociation is. So dissociation is what we think of as a disruption of the continuity and normal integration of our consciousness, memory, identity, our emotions, and our senses. And it's really an adaptive process that, like many things in mental health, are on a spectrum. It's an adaptive process that in some ways actually protects you from reliving traumatic experiences. Can be a way of the brain concealing what happened, so to speak. For many people that are experiencing a significant trauma, while that trauma is happening, they might have some form of dissociation where they feel like they're floating outside of their body. Or I've heard people say that they felt like they were on the ceiling looking down at what was happening to them. And there can be mild forms of it. In some ways, daydreaming is a mild form of dissociation. People can dissociate in different ways while they're driving on a freeway. You might have that experience yourself of driving somewhere and all of a sudden realizing, wow, I haven't really been paying attention for the last 20 minutes or so. And there could be positive forms of dissociation that can be sustained for long periods of time that can actually foster a person's resilience. Some people who have lived with dissociation for some time actually develop adaptive skills, a way of kind of dividing your attention so that part of your awareness can be monitoring a threat while another part of your awareness is attending to other stimuli in the environment. There's been some research that suggests that positive forms of dissociation can lead to greater ability to engage in fantasy and might even increase a person's creativity. And there's something that we think of as volitional dissociation, which is something that professional athletes or people in the military, even performers, can go into a dissociative state where they're managing their painful training, their experiences. Actors who merge with a character that they're playing can actually absorb emotional states, even postures of the character that they're playing. And this can have positive benefits as far as their performance, but in some cases, it can actually have some long-term negative impacts. Some experiences of trauma can really shake a person to their core. They can sort of turn everything upside down to the point that as a result of the trauma or traumas, you start to doubt your self-worth. You question your identity, your own thoughts and feelings. It can damage your belief system. And there can be physical and emotional states of shock And when that happens, the brain acts to create levels of dissociation, which are sort of a form of escape. It's an involuntary detachment from the reality, a disconnection from the sense of self and thoughts and memories. And when it starts to be more significant on that spectrum, we start to see how people can actually start to feel disconnected from their own feelings, from their body and their surroundings. When we're overwhelmed, the body and the mind seek safety. So this is an internal sense of seeking safety internally. It's actually part of the fight, flight, freeze, and fawn response. It's an involuntary survival network that becomes activated. Dissociation is something that people can experience during periods of grief and mourning. And unresolved, that can actually have some negative influence on resolving trauma and loss. It's during the freeze response that we can experience this kind of dissociation and disconnection. Often the brain resorts to dissociation when there are no other options for escape available. It's similar in some ways to a survival response that some animals might exhibit when they're playing dead, for instance. It improves your chances of getting out of it alive. So it can actually be a helpful strategy at the time, but it can also arise later in life, which can cause problems in a person's daily functioning, especially when a person is triggered by reminders of particular trauma, whether it's conscious or unconscious. You know, a conscious reminder is seeing something that brings an event back to mind. An unconscious reminder might be smelling something that unconsciously reminds you of that incident that happened. And unfortunately, trauma can actually change the form and the function of the brain. So dissociation can feel like being disconnected from the body, having out-of-body experiences. It can feel like numbing or emotional detachment. A person can experience a shift in their sense of identity, of who they are. They might forget events or even forget what you were feeling at a particular time in your life. Some people can actually forget personal information about themselves. Often when people are dissociated, there's a reduction of physical pain because we're in that kind of freeze, detached response. You can feel like you're separate from the world around you. Some people have an experience of depersonalization, where they feel like they're outside of their body, kind of floating as if you were watching yourself in a movie, or derealization, where people and things around you seem like they're not quite real, like you're sort of in a dreamlike state. Sounds can be distorted. Your vision can be distorted. Dissociation can also be part of different mental health disorders, including borderline personality disorder. Often people with BPD have an early history of significant trauma. Dissociation can be an element in PTSD, and people can experience things like dissociative amnesia or trance disorder. In extreme cases, we think of dissociative identity disorder. This is something that people used to think of as multiple personality disorder. And dissociation can be an element of attachment disorganization. One form of dissociation is what we think of as maladaptive daydreaming, where people experience intense sort of off-task thinking that can lead to neglect of real-world tasks. They can experience kind of an addictive need for intensely absorbing fantasy. This often co-occurs in people that have ADHD or obsessive compulsive disorders or anxiety disorders and some forms of depression. So given that dissociation is actually an adaptive response that can actually be protective in some instances, we do want to look at, though, when it starts to become problematic, how dissociation can be treated. And it can be treated through trauma-informed therapy, including CBT, DBT, EMDR, different somatic therapies. People can treat their dissociation by developing healthy grounding techniques to bring your body and your mind more into the present moment. Distress tolerance techniques and emotion regulation techniques and mindfulness techniques and interpersonal skills training can help with dissociation, and various conscious breathing exercises can help people feel more connected to their body. And as a result of feeling more connected to your body, you're then better able to process your emotions and maybe even to process some of the trauma that led to the dissociation in the first place. This really just kind of scratches the surface on what is really a fascinating topic of dissociation. And there's a lot more to learn about it, to say about it. I encourage you to leave some comments and maybe share some experiences, ask some questions, start conversations with people. And if the videos are helpful, I encourage you to like and subscribe, sign up so we can let you know when there are new materials coming out. And until then, take care of yourself and take care of one another. Bye-bye.